Good morning to you all. I would like to thank Kent County Council, Department of Health and obviously here for inviting me to share my experience of telehealth with you. Please allow me to introduce myself. My name is Haris Patel. I'm 54-year-old. I live in a small village near Folkestone in Kent. I suffer from ischemic heart disease, Parkinson's. I've had a number of strokes, peripheral vascular disease, hypertension, which are all long-term conditions. I've been using telehealth since August 2006. I was referred to telehealth by Dr. David Smithard. Some of you may know him. He's one of my consultants who look after some of my long-term conditions on a regular basis. Before I was referred to telehealth, I used to spend at least 8 to 10 months per year as an inpatient in hospital. My GP used to visit me at home on a regular basis. District nurse used to come to my house every other day to take my blood pressure. I was not able to plan my life on my good days due to having to stay at home for the medical support team to come and take my blood pressure. When I was referred to telehealth, and when Sharon Lee, then community matron for Shepway PCT, visited me at home, I had doubts as how telehealth would help me with my long-term conditions. Since being on telehealth, my blood pressure is monitored twice a day, morning and evenings, lying down and sitting in my wheelchair. By being on telehealth, my blood pressure is monitored daily. Matrons, GP and consultants can view my data via computer, and by having this important information at hand, they can refer me to appropriate professional person to see me. I've been referred to Guy's Hospital, and I have been seeing Professor Farrow, who specialises in hypertension. He has been monitoring my blood pressure and changing the medication that works best for me to reduce the blood pressure. My blood pressure is much lower than it used to be, but he's still working with me to reduce it even further. Since being on telehealth, lots of important things have changed for me. I used to be with Kent County Council Social Care, and by being on telehealth, I was assessed by the medical team from healthcare sector. Now I am with healthcare continual care system, which is fully funded by NHS, and all my needs are met by NHS. Telehealth gives me peace of mind, as I can be assured that when my readings are transferred via telecommunication to nursing centre, and if there are any concerns regarding my blood pressure or blood sugar level, it can be addressed instantly. If my medications need changing, then the matrons can get in contact with my GP or consultant, and the correct medication can be prescribed. Home visits from GP and district nurse are not so frequent as they used to be prior to being on telehealth. Most importantly, my hospital admissions as an inpatient have reduced in the last 5.5 years. I have spent 5 weeks as an inpatient. 3 of them weeks were planned admissions, compared to 8 to 10 months per year what I used to be. What does telehealth means to me, and how has it affected me personally? Being on telehealth has given me full control of my life and my independence. I can plan my day as I wish, go shopping with my carer, do some gardening as and when I'm well enough to do so. I can visit my friends locally to where I live, and about all, telehealth has opened so many doors for me. I'm involved with public involvement group with Kent County Council. I'm a part of telehealth support network, volunteer support network group. It gives me a chance to help newer telehealth client with any problem they may have with telehealth equipment, and to communicate and support one another. Recently, telehealth and Kent Telehealth Support Network Volunteer Group met up and had a meeting with French delegates at Ashford Business Point. They were very interested in how does the telehealth and look our input back to France, and hopefully they will have a pilot scheme in France. And finally, I have managed to achieve confidence and self-esteem, which prior to being on telehealth, I totally lost. Thank you for sharing my experience of telehealth.